Did it say starting recording? Good. Okay. Welcome everybody to the speaker series, DBT therapy with SUD with Megan Vernon. Um, I just want to cover a couple things. These sessions are hosted by the Southern Utah University Center for Rural Health. That's where I work. And the speaker series is funded through the Rural Communities Opioid Response Program grant. We will be recording these echo sessions. The slides and recordings will be available and emailed out to those that registered and attended. Please feel free to share the registration information and the sessions, and we will be monitoring the chat and helping facilitate questions. Just a reminder that those located in Carbon, Emery, and Grand counties are eligible for a $50 stipend per complete session attended, and I will be tracking the attendance, and then at the end of the 4 sessions, contact those who qualify. And then I'll be posting a quick pre and post poll at the beginning and end of each session. Please make sure to fill them out. It helps us report the collected data and for us to continue to be grant funded. So we appreciate it. I'll introduce our speaker. It's Megan Vernon. She's CMHC, the Chief Clinical Officer with New Roads Behavioral Health. She is DBT Linehan. Do I say that right? Lennon?
Linehan.
Linehan, Board of Certification Certified Clinician. And she is a certified EMDR trainer. She has 13 years of experience. She is dedicated and highly skilled clinician focusing on helping individuals navigate complex mental health and co-occurring substance use disorders. She's recognized as an expert in DBT and brings specialized knowledge in trauma-focused therapies to her practice. We are so grateful she's here to share with us today and the next 2 sessions. So I'll turn the time over to her.
Perfect. Thank you. So, as we're doing this series, we are continuing from what we did last week. So, last week was focused on a brief overview of DBT and specifically going more in depth with the validation strategies that are utilized. Were there any questions before we jump into this next thing that came up from if you were in this last session or wanted to hit on before we move forward?
And we are monitoring the chat if you want to do that, or just unmute yourself and speak, whichever you prefer.
Okay, if there are any questions, as Chris said, put them in the chat or let us know, but we'll go ahead. So for right now, we're kind of shifting our topic over to skills. And so skills are what I think most people associate DBT with. Marcia, a lot of it was not necessarily new or groundbreaking. Some of it was. She just organized things very differently. And she really had a key central focus within the skill sets as well. So when we're looking at the function and target of the skills training specifically, this is done in a psychoeducational format. So most of the time, depending on your situation and your area, what your organization that you practice in allows for. It is done in a psychoeducational format in a group setting, though this can be done one-on-one individually in your individual sessions as well. So with groups, there's a routine with it where you kind of work yourself systematically through the skill sets. And then again, it can be an open group, a closed group. Most of the time it is open where clients are able to come in at any time and just pick up with the skills that they are at within your agenda curriculum within that. If it is only being done on a one-to-one, you do want to allow either extra time in your session or have the session set up in a specific way so that you can give a little bit more time into doing the skills and teaching and helping individuals acquire the skill set. Oftentimes, the group might be taught by a different therapist, so a skills trainer versus the individual therapist. So it can also be done by you as the individual therapist, running those groups as well as doing the individual therapy. And the main function, the main focus of skills is to help increase the capabilities to change. So if I'm going to tell you that you cannot use substances, I need to give you other behaviors to help you navigate and be able to tolerate cravings, urges to go and use, direct triggers of what would have you use in the past. So it is to help increase their abilities to navigate those situations more effectively without going into using and maintaining their substance use. And it is done to increase their skills acquisition. So skills acquisition is how I'm teaching, presenting the information, and then we're strengthening it. We're practicing it. We're going into role plays with it. So DBT, based on those 5 areas of dysregulation, the skill sets focus on those 5 things. So we have mindfulness, which is core mindfulness. Mindfulness is threaded throughout all the other skill sets, and that really targets the cognitive and self-dysregulation. Next, we have interpersonal effectiveness. Again, that's going to target interpersonal difficulties, issues on how to navigate through the interactions that they're having with various people in various contexts in their lives. We have emotion regulation for the emotional dysregulation and distress tolerance for more behavioral dysregulation. So when we're looking at mindfulness, so mindfulness is defined as paying attention in a particular way with openness, curiosity, acceptance, and flexibility. It's focusing on accepting what is. If you think of mindfulness, it's a way it often gets put with meditation, and I would say that they are on 2 ends of the same spectrum, but they have slightly different intentions behind them, where meditation is more not wanting to focus on anything in particular and kind of clearing your mind of thoughts. Mindfulness is taking one thing and being very intentional, paying attention to that thing with openness, curiosity, acceptance, all those things. So one thing versus nothing is kind of the 2 difference between them. And mindfulness has been researched a lot, and it has been proven to be effective as a component of treating substance use disorders. So I have learned that he is no longer there, but Eric Garland was previously associated with the University of Utah, and he established MORE, so mindfulness-oriented recovery enhancement, which is a great resource that really specifically applies mindfulness strategies to addiction and substance use disorders. Mindfulness studies also within that have shown that individuals with substance use disorders are able to improve and maintain their recovery. They have a reduced fear response, so they're not so worried about doing anything or being scary, walking on eggshells. They have an ability to participate in trauma therapy and have a reduction in dissociative responses. They're having neuroplasticity, increased hope, pleasure, and their prefrontal cortex is functioning better. So they're kind of tapping into this front portion more often than just hanging out in their limbic system. So when we're looking at the core mindfulness skills, they are broken down into our what skills and our how skills. And so the what skills we're trying to do sequentially, one at a time. So the first thing that we're going to do is observe. And when we observe, we're just going to notice. We're paying attention. We're tuning in. So I'm just noticing, just observing what's going on within me, maybe what's going on outside of me. And then we first have to kind of be aware. Again, we have to notice, be aware, and then we can move into describe. And describe is where I'm going to put words to what I'm observing. I'm going to label it. I'm going to be able to talk about it, think about it, articulate it. And from there, then we move to participate. And participate is I'm going to fully throw myself in. I'm going to fully engage with the present moment, what's going on, what I've observed, what I'm describing. I'm going to very much participate within this full-heartedly. So those are our what skills. So this is what you do to be mindful. And how we be mindful and how we do this. So these we do sequentially with each other, or congruently, not sequentially, congruently with each other. So first is we're going to be one mindful. We're going to take one thing at a time. We're going to allow our attention to focus on one thing at a time. I used to think that I was such a good multitasker and I could do so many things all at once, and the research disproves that. Good multitaskers are actually very good at being one mindful. They are allowing their mind to go to one thing for a brief amount of time and then switch it to the next thing for a brief amount of time. So they're just very good experts at being one mindful and doing one thing at a time, giving that our attention. We're also going to do this with a non-judgmental stance. Judgments happen all the time. Our brain is, I think, is somewhat programmed to be doing and being judgmental. And so non-judgmental stance, again, if I can just observe and describe very factually, I can be non-judgmental. I'm not putting my opinions in this. I'm not making assumptions with things. It's really kind of being very fact-based, very factual. I'm not getting in a judgment spiral loop where I start judging my judgments and, oh my gosh, I just did this crap. Like, we're coming back and just being like, okay, I just noticed that. Now I'm going to come back. There's those thoughts again, and we're not judging it. And then we're going to be effective. We're going to intentionally do things that work and are the most healthy, most effective things for us to do. So the consequences are more positive than negative. We are enjoying the outcomes with them. We're doing what works. And that is how we be mindful. So mindfulness, again, is the core. So when we're looking at like the criteria of the skills groups, what Marcia says is you start with mindfulness. It is the core. You're going to see it threaded throughout the other skill sets. So you start with mindfulness, then you would move to your next skill set, go back to mindfulness, go to your next skill set, go back to mindfulness, and then the next skill set. So they are getting more mindfulness just because that is how important it is to the other skill sets, to the individual, to recovery, to making the progress that they need. Next, we have distress tolerance skills. So the distress tolerance skills, I will say, individuals that I work with have a love-hate relationship with distress tolerance skills. And it is because it is distress tolerance. They are feeling distress, they are going to have to tolerate it. It doesn't change it. And so with these skills are designed to help individuals tolerate and then survive a crisis without making it worse. We're not going, like, we're going to sit in our shit. We're not basking in it. So within this, we have two types of skill sets. So we have the crisis survival skills, which is this column over here. This list is our crisis survival, and we have reality acceptance skills. So these skills right here on the right side. And when we're looking at distress tolerance skills, it is helpful to keep in mind that in the midst of high, intense emotional distress, the chances of an individual being able to recall, remember, to implement skills is low. And so we're looking at subjective units of distress, and we're trying to find a sweet spot within this. And there's a thing that we identified, or that Marcia identified, as what she calls a skills breakdown threshold. And this is looking at that subjective units of distress scale. Skills sweet spot is really going to be that 5, 6, 7, maybe 8 range. That range is going to be where skills are going to be very effective. Once you're moving past that range, it's going to be a lot harder for them to be effective. The individual's not going to really remember or recall, because at that point, they're just full emotion mind. They are not going to be able to recall these really that great. And so we want to intervene in these sweet spots. If you're looking at this too in like a color situation, a green light, yellow, red, skills are where you're in your yellow range. It's really hard to use skills in that red zone. Not impossible, it's just really hard. And in those moments when an individual reaches their skills breakdown point, the skills are not going to feel effective. They're frequently going to be told they're not working, and it's going to be hard for them to self-initiate it. They do better with using those skills when they have an external coach. So when we're breaking down the crisis survival skills, the first one is TIP. So within the skill set, Marcia loved acronyms. So a lot of these have an acronym within them. They are meant for different things. So we're going to break these down a little bit. So TIP is really focusing on tapping into the body's natural responses. And TIP stands for temperature, intense exercise, paced breathing, and progressive muscle relaxation. So temperature within TIP, we are specifically focusing on cold, so cold temperature. And the specific aspect with the temperature is to activate and tap into what is called the dive reflex. So the dive reflex is really like your body's reset system. And how we can access this is you get a bowl of cold water. You might put some ice in it, but not so freezing that you're gonna like frostbite your face. But it is cold water, and you're going to put your face in the cold water for 10 seconds. Come up, take a breath, put it back down for 10 seconds, come back up, and then do that a third time. And this motion, especially hitting this part of your face with the cold water, activates that dive reflex. And it's literally like pushing the reset button on your system. Everything stops and starts. And this kind of creates a window for you to then have other skills be more effective. So that's the temperature part. Sometimes I've had clients complain about the tip bowl situation because it's like I just did my makeup. I'm not, or I'm in a place where I don't have it available for me. That's where we have other skills, or you can modify this slightly. Those cold masks that you can put in like your fridge or your freezer. Again, the key part is hitting like the soft spot underneath your eyes to activate that dive reflex. Intense exercise is you're wanting to get your heart rate elevated. So you're going to do cardio, jumping jacks, burpees, knee highs for like 20 minutes to get your heart rate elevated. And then when our heart rate is elevated after we've exercised, our brain and our body is like, no, I don't like this. We need to get back to our baseline, our normal. And so then it's tapping in, it's trying to calm our system down, get our heart rate back to its baseline, more regulated. This one, if someone struggles with like an eating disorder or you have concerns about that, you would not have them do the I part of it, though they could do other aspects of it. And then P, there's two in the P's. So we have paced breathing, and paced breathing is you're going to have a longer exhale than you do inhale. And usually it's a 2 to 4 second longer exhale than inhale. So usually it's you take a breath in, 1, 2, 3, 4, exhale, 1, 2, 3, 4, 5, 6. And do that for a few rounds of breathing. And what this does is it essentially starves your body of oxygen so that on your inhale, it's going to pull the oxygen through your body faster. Your brain is going to recognize that you have oxygen and it's going to calm you down. And you do paced breathing with paired muscle relaxation. And paired muscle relaxation, you can start on toes, hands, other sides of your bodies, but it's essentially you're tensing both sides of your body. You're pairing those together at the same time. And again, this is to help relax your system. Oftentimes our emotions hang out in our bodies. We get tense with things and we don't always notice it. And so being able to tap in an intentional way kicks our brain on out of the emotional distress of it and gets us to calm down. So just with your hands, and you can do this with me if you want to. So we'll do my hands so that you can see them on the screen. Again, you can start toes, bottom of your feet, hands, but you're going to tense them as tight as you can for 5 seconds and squeeze it, squeeze it, squeeze it. 1, 2, 3, 4, 5, and then you're going to slowly release it out. And you can kind of feel your tendons kind of tensing, kind of twitching, resisting that. Okay, and then you're going to do it again. And so you kind of tense each part for 3 times, and then you're going to move to the next muscle set. So if I started with my hands, then I'm going to go up to my biceps, my arms. We're going to tense them, we're going to flex them, then relax them down as slow as we can. And then you'll move to like shoulders, neck area, down to the abdomen, bum, legs, down to your toes. And so you're working through this. And again, this is tapping into the body's natural stances that it wants to get back to a baseline, more equilibrium, relaxed state. So that's the tip skill. So tip is often used when you need to create a window and then follow it up with other skills. Next, we have stop, and stop is an acronym. So the S stands for we literally are going to stop. T, we're going to take a step back. O, we're going to observe. Here's our mindfulness coming in. We're going to kind of assess things, just take in what's going on. And P, we're going to proceed mindfully. So I'm going to stop, take a step back, create that space, observe what's going on, and then proceed mindfully and make the most effective choice. Next, we have pros and cons. The pros of using, the cons of using, the pros of staying sober, the cons of staying sober. And you can put all the layers on pros and cons. So you can do a tit for tat, how many pros to how many cons. You can do it emotion laden. So you write down all your pros and cons, and then you're independently going to take everything that you put on there and rate it on a scale from 0 to 100 of how big of a deal is that one thing. Because you can maybe have all these pros to one con, but that one con is going to trump and outweigh emotionally for you all of the pros. And so pros and cons gives you information, and it's meant to help you make the most informed decision going forward, that you're going in eyes wide open as best as you can. With coaching someone with pros and cons, we're going to be very active in this. They may not always be able to think of pros and think of cons. Obviously, I might have a stance, especially like in a substance situation, like I don't want my client to use. And at the same time, doing pros and cons, yes, I'm totally biased and I'm geared to like, here's the cons and this is why you shouldn't use, here's all the pros of being sober. And I'm also going to maybe not be as forward and forthcoming, but I am going to chime in on the pros of using. It works, right? Like you feel better, you get high. Yes, you're hungover and you have all this legal stuff. So we're going through and we're highlighting it on both sides. We want it to, again, give as much information to be the most informed decision that we can make for our clients going forward. Next is distract with accepts. So accepts is the acronym portion of this skill. Distract with accepts is often, I would say, one of the go-tos for a lot of clients because it's easier. It's also a pitfall because distract with accepts is supposed to be a short-term temporary thing. Distracting constantly becomes avoidance. And so it is a short-term distraction, and it really is to help get you through a situation, get you through the moment. So accepts is the acronym. So A stands for activities. What can you do that's going to distract your mind? And you're going to create a whole list of things that they can do individually, things that they can do with other people, seasonal dependency, what's going on weather-wise with things. So having a good variety of activities might be reading, playing basketball, playing a video game, talking to a friend, all types of activities that they can do. The C, the first C stands for contribute. So contribute, how can I give back to someone else? What can I do to be of service? The next C is compare, and comparing in a way where there has been a worse situation that they have been able to successfully navigate. And we need to be careful with this compare where we don't want to really have it be at least, it's not this. So we're trying to avoid the at least when we're doing comparisons, where it's like, hey, I have been in worse situations and I was able to get through that. I can get through this too. E is emotion. So we are working on changing our emotion. So if I'm like feeling really sad, down, and depressed, I'm not going to be isolating, hanging out in my room. I'm going to be, okay, if I wanted to be happy, what would happy people do? I'm not listening to the sad music. I might be listening to Happy from Pharrell, right? Positive, more upbeat tempos with things. So we're doing active things to distract ourselves from the negative emotional state that we're in and doing things that are opposite or allowing us to be in a different emotion state. P is we're going to push away. We are getting space. We're giving ourselves some space from the situation, scenario, right? Like we're pushing away, giving us some distance from things. We're going to work on changing our thoughts. So instead of being like, oh my gosh, I'm craving so bad, how can I distract with other thoughts? How can I reframe my thoughts? How can they be different thoughts? Maybe it's like, oh my gosh, I'm this far in recovery. Yeah, but and you compare this with a comparison, right? Or pair it with comparison. Yes, I'm having cravings now. It's not as worse as when I was freaking detoxing and in full withdrawals. I can get through this. I can give myself support and encouragement. Then the S stands for sensations. And sensations in this is we truly are going through our senses, but we're doing them in a way that is slightly aversive because it's meant to be distracting. And so this can be biting into a lemon, having a little bit of lemon juice, and you're going to get that response. It might be smelling a very aversive essential oil or putting a warhead in your mouth, loud music like a slamming of a door, just to kind of shock your system a little bit. This sensation can be cold as well, like its tip, but instead of necessarily focusing on this area, it could be holding onto a bag of ice. It could be putting an ice cube in your mouth and pushing it to the roof of your mouth. It could be taking a really hot shower that's like slightly unpleasant or a cold shower. So you're playing with the sensations enough that it is more aversive because it is trying to distract your mindset. Then that kind of is different from the next skill, which is self-soothe. And self-soothe is we're doing soothing things. So you can tap into your senses with this, but they're the pleasant things, they're the enjoyable things. Curling up in a soft, fuzzy blanket, eating your favorite foods, ice cream, smelling a good smelling lotion or putting that on, listening to your favorite music, kind of giving yourself a little TLC, taking a nice warm hot bath, right? So you're doing things to take care of yourself, to soothe you, just like we would with like a little baby or kid, things that we enjoy. Next, we have improve. And improve, again, it's an acronym. Marshall loved an acronym. So improve is we're trying to improve the moment. And how we can do this is eyes imagery. Imagine a safe place. Imagine your favorite thing, being in the mountains, on being at a lake, fishing, sitting at a beach. You're creating an image that they can tap into. It could also be looking at photos or Googling something that they can literally see an image of. Next is meaning. We want to be able to find meaning in the situation. What is the purpose behind what I'm going through? Kind of taking a page from Viktor Frankl and existentialism. How can I create purpose out of this situation that's really hard and is distressing for me? What is the meaning that resonates for me to help me navigate through this? P stands for prayer. And this is asking in a way for support. It's not a why me prayer. It is very much a different type of prayer to like give me strength, help me get through this, help me navigate, right? Going back to how Marcia originally came up with this, she prayed to God or told God, like, if you help me get out of this, I promise I'll go back and help other people. And so she felt like prayer and tapping into something greater than yourself or praying to the universe, kind of a 12-step situation going into this, is very helpful and beneficial. R is relax. We're going to do things that are relaxing. We're going to give ourselves a little bit of a break for things. If it's more relaxing for me to just take a second and breathe, to sit down, put my feet up, I'm going to do those things. Oh, again, this is our mindfulness piece. This is one thing. So we're going to do one thing at a time to help us improve the moment because maybe we're getting really overwhelmed with what's happening and I just need to make it smaller and bring it back one thing at a time. B is a brief vacation. So vacation, if you are able to take a trip, great, and actually go on a vacation, awesome. Though that is not always the reality. And if it's just trying to get through this moment without making it worse, how can I have a brief vacation? It might be, okay, I'm going to take the next 10 minutes and I'm just going to chill. I'm going to watch a funny video on my phone. I'm going to give myself a break. I'm giving myself permission to take an adult time out in a good sense, not because I'm in trouble, just because I need a break. And E is encouragement. We're going to be our own cheerleaders. We're going to give ourselves a whoop, whoop, go me. I got this. I can do this. Look at me go. As well as like, okay, I'm going to be my own cheerleader. Okay, we've got this. I can move through this. I can power through. This can be positive mantras, self-statements, whatever is encouraging for the individual. So those are our survival skills or our crisis survival skills. Next, we have the reality acceptance. So radical acceptance. So again, acceptance is acknowledging that I do not have control in this moment and I cannot change it. And so I have to radically accept. So I have to constantly jump and remind myself that this is not within my control. And when we allow for acceptance, it decreases this fighting, right? So if there is this chair in my office that I hate it, I can't stand it, I don't want to look at it. So I'm constantly like, oh my gosh, don't look at the chair, don't look at the chair. Oh my gosh, it's still here. I can't believe it. Versus if I accept that the chair is there, it can have its space. I'm not in this tug of war with it. I'm not in this battle. And it allows for a sense of relief. Turning the mind is I will constantly have to remind myself and bring myself back to being mindful, to accepting, and we're constantly having to do it. It is a repeated action. And sometimes things are really hard to accept. And so we have to repeatedly turn our mind to accept as it is. Next, we have willingness. Willingness is allowing ourselves to be open to the situation. And this gets paired often with this one below it, half smile and willing hands. And this is physically changing our positions, our body postures to be in a willing stance. So half smile is we really are going to have a soft, relaxed smile on our face. We're not showing teeth. It's not like a forced, it's very much it's very relaxed. Our face muscles, if you try this, you can feel them kind of relax into it. It's not this tension thing. And with willing hands, our hands are going to be kind of open in the stance, resting in our laps. Because if I can do this, this tells my brain there's not a threat. We're safe. We can be open to this situation. Willing hands and half smile get paired together. Because again, if I can smile, communicating to my brain, we're okay. The tension can melt. This is not going like this and prying your fingers open and all the tension. It's very relaxed. They're kind of resting with their own weight in your lap, giving you this open stance. So again, the goal of distress tolerance is how can I get through this situation, tolerate the emotions that I'm experiencing, and not make it worse. Okay, next we have interpersonal effectiveness skills. So again, this is anytime I'm interacting with another person, I can use these skill sets. So when we're looking at if our goal is how to ask for something and have the best opportunity to get it, we're going to use the Dear Man skill. And Dear Man is also used when we want to be able to say no and stick to it. So Dear Man is the acronym and it stands for describe. I'm going to highlight, set it up, what I'm asking for, why I'm saying no. I'm describing the situation. We're going to express. I'm going to express why I'm asking for what I'm asking for. I'm going to assert and remind us like, okay, this is what I'm asking for. This is why I'm asking for it. We're going to be assertive within this. We're going to reinforce it. Why is this a good thing? Why do you want to give me what I'm asking for? We're going to stay mindful. I'm going to ask for one thing at a time. We're not asking for all these other things. I'm not getting distracted in this interaction. I'm sticking to this one thing. I'm being mindful. Then we're going to appear confident. Doesn't mean you have to be confident. You just need to appear confident. You have to kind of sell why I'm asking for what I'm asking for and why you should give it to me, why it's going to be a good thing. And then we're going to negotiate. This is a back and forth part of this. This is what I might be willing to shift or give up in order to get what I want in the most effective way possible. So that's our Dear Man. And again, how to get something and have the best opportunity to get it doesn't mean you will always get it. Our clients here will say, like, can I Dear Man you? Because they want the approval before they actually do the step. We don't do fronts with this. You need to Dear Man me. You can always Dear Man. Just because you Dear Man, it does not mean you will always get it. It just gives you the best opportunity. Or it allows you to say no and feel like confident in being able to stick to it because I've described why I'm saying no. I'm expressing why I'm saying no. I've asserted that. I'm reinforcing why I'm saying no. I'm not getting distracted by the other things. And sometimes the negotiation is in I'm not open to negotiate because it is a no. So when we're looking at relationships that we want to keep and have in our life, or needing to improve that dynamic, we're going to use the give skill. So the give is we're going to have a gentle approach. We're not coming in hot. We're coming in nice and easy. We're going to act interested. Even if you're not, you're going to act it. You're going to give them your attention. You're going to be with them. You're acting interested. You're doing the nonverbal body language cues. You're going to validate. We teach the individuals that we're working with the same validation strategies that we use ourselves. So we're teaching them how to validate. And then we're going to have an easy manner. That allows us to improve those relationships, have a stronger chance of keeping the relationships, and have them be effective and meaningful going forward. Next is self-respect. So this is when we're trying not to be a people pleaser. We're trying not to be the doormat. We're trying to have our backbone, maintain our self-respect. And this is the fast skill. So fast is we're going to be fair. We're not hitting below the belt or being very fair in the interaction with the individual. We are not overly apologizing. We are not saying sorry for maintaining a limit or a boundary or explaining what's going on. It's not, oh, I'm sorry. I'm so sorry. I need to do this. It's no, we're not overly apologizing. This does not mean that you cannot apologize. We're just taking out the overly apologizing. It's okay to say what you're going to say. It's okay to set limits. It's okay to set boundaries. Next, we have S, which is sticking to your values. I'm going to align with my values. What I deem to be important and meaningful and of worth, I'm going to align to those. I'm not going to shift those to accommodate someone else because, again, this is my self-respect and I need to align to my own values. And then lastly, we're being truthful. We're not going to exaggerate or elaborate where a fish is maybe this big and all of a sudden in the story it's this big. Nope, if the fish is this big, it's this big. We're being truthful. We're sticking to the truth. We're not lying. We're not making an assumption. We're sticking to the truth and the facts as we have it. And then our last skill set is emotion regulation. And this is the next skill set that I think individuals have a love-hate relationship with because, again, it's regulating your emotions. It's not numbing your emotions. You are going to have emotions. We, as humans, are emotional creatures. We feel them. We experience them. And so when we're looking to regulate our emotions, the goal with this is to identify and label the emotion that you're experiencing. So I feel like, especially with individuals with substance use disorders, they have numbed their emotions for a very long time. And they may not be able to tell you what they're feeling. They're just feeling something. And what they know is, I don't like this. This is uncomfortable. I'm not having fun. I don't like this. Ew, right? So we're working on identifying and labeling the emotion. You can pull an emotion wheel. We have individuals watch Inside Out, which is a very great basic level of introducing emotions within an individual aspect of things with that. So again, they're identifying and labeling the emotion that they're feeling. Because based on what emotion it is, other skills are going to be very different. We're also teaching on how to reduce the emotional vulnerabilities. And what is making us more susceptible to having intense emotional spikes or discomforts or negative emotional experiences. So how can we reduce those vulnerabilities? We're going to move from emotional suffering and increase positive emotional experiences. And then lastly, they're going to learn how to change or reduce an emotion by acting opposite from what that emotion is trying to get you to do. So below, these are the skills that are associated in our emotion regulation skill set. So the first one, the abbreviation with this skill set is ABC please. So that's, even though there are other things within the skill set, most of the time, if someone has been in DBT and you ask them emotion regulation, they'll say, oh, ABC please. So the A is the accumulate positives. So this is you are intentionally doing things to notice positive things or do positive experiences to generate having positive experiences. So this can look as simple as doing gratitude journals, identifying good things that happened throughout the week or your day, being able to, if I know hey, it would be really fun to go to the lake and hang out, I'm going to go to the lake and hang out because I haven't been there sober in however long. And so we're creating and they're engaging in behaviors, experiences that are going to help them have fun and enjoy and be happy or make life positive versus this just sucks because life is hard enough without us highlighting those things. So we want to shift it to being able to identify, notice, highlight, and create positive experiences. The B, so ABC, the B is build mastery. And this is really targeted to like work up and develop self-esteem. So this is starting with something that you may not know how to do or be very good at, and you're going to practice it. You're going to engage with it. You're going to improve your mastery over that situation. You're building self-esteem. You're having this sense of accomplishment. So whether this is working out, knitting, reading, because I went from reading picture books to chapter books to huge J.R. Tolkien level situations, whatever it might be, tapping in and creating hobbies, things that they might want to enjoy. And this is where I compare with accumulating the positives. Though they're working on something consistently, building up that self-esteem and having this sense of mastery where they can look back and be like, oh my gosh, wow, I did this. Next, our C's are check the facts and cope ahead. So check the facts. This is where mindfulness comes into play. We're not judging what it is. So I don't have this rug anymore, or else I would show you. But previously in my office, I had a yellow rug that had a white pattern ribbon through it. And I thought it was fun and happy, and it like brightened up my office. And I had a client that hated it. She thought it was the worst. Yellow, it was like the color of Satan. Like, how dare I have this yellow rug in the office? I was doing it intentionally to destroy her life. And those are our interpretations of it, right? Where when we're checking the facts were or are, it is a yellow rug with a white pattern. So the facts are what is other people would say that they are, what the normal society at large is saying, without the interpretations, without the opinions, without the emotionally charged thing. We're just kind of bringing it back to, okay, what's the information? And then we have cope ahead. So cope ahead is essentially skills within a skill. So this is if I know that there is going to be a difficult situation coming up for me, whether that's I'm seeing my family for the first time, I'm going to court and I'm really nervous about my judge, or there's an anniversary date coming up, or I'm going to go to a funeral of a friend that died from an overdose, and I may see other people that I used to use with. Or there's this artist that I'm obsessed with and they're coming into town, and I know at their concert that everybody's smoking weed and I really want to go. This is when we would use cope ahead. So this is a future date that we know is coming, and we're essentially going to practice and rehearse navigating that situation effectively. We're getting through it as chef's kiss, as ideally as we possibly can. So again, we might introduce other skills into this skill, but the biggest thing, the key thing within this is rehearsal. We are practicing it, we are role-playing it, we are visualizing, getting through the hard, difficult situation. Perfect, like sober. We didn't relapse. We showed up the way that we wanted to. So we're coping ahead for that situation. And the key is we're navigating it effectively. We're getting through it great. This is not same as playing the tape forward of like, okay, yeah, you could go and use, and then what would happen? You'd have to UA, you have a dirty UA, then your PO is going to get mad. He might throw you in jail, might make you do treatment, extend treatment. I'm going to be mad. So that's playing the tape forward. Cope ahead is similar but different in the sense that, okay, I didn't use, I got through this the way that was effective and beneficial going forward. Then we have, so the opposite action, reduce and problem solving, those are not part of ABC, please. So opposite action is connected to that last learning objective of reducing an emotion by acting opposite to what the emotion is trying to get you to do. So opposite action, let's say that I'm struggling with depression, and my depression is saying I just need to lay in bed and not move, and I just need to sleep all day. Opposite action is breaking it down, and okay, if you weren't depressed, what would you be doing? What would a happy because that's always the goal, right? Well, I just want to be happy. Okay, what would a happy person be doing? So in this moment, yes, your depression is saying stay in bed and go to sleep. It's waking up with the alarm. It's getting out of bed. It's taking the shower. It's putting on clean clothes, doing my hair, going outside. So you're breaking those things and you're acting as if you would if you were happy. And what this does is this kind of shifts to having the more emotion that you're trying to have starts to come in more and more. A very simple example of this is if you start fake laughing, you eventually start to real laugh. And it's because you're acting as if you were laughing. And that triggers your brain to then start actually laughing. Next, we're going to reduce vulnerabilities. And this is, I'm going to not put myself in situations that I know are going to be emotionally distressing or upsetting for me. I'm going to intentionally be conscious of things around me. So if my blinds are blacked out and covered out, I'm going to open them because I'm going to let light come in versus drowning in my sorrows and listening to sad music, right? So we're doing things to help reduce those vulnerability factors. And the key thing within this is how we reduce them is the please skill. So please is the acronym in this skill set. And this is really how to reduce these emotional vulnerabilities. So please, and I'm going to vary it a little bit from what Marcia in her skill set says, because she was stretching on this acronym. She was really stretching. So the PL in Marcia's is physical illness. But I'm going to just have the P stand for treating physical illness. If you are sick, take care of yourself. This might be rest, making sure you have fluids, going to a doctor, taking an antibiotic. So you're doing what you can to treat your physical illnesses. L, version of Megan, is you're going to limit your screen time. We're not doomsday scrolling, we're not vegging out and binging all the shows and everything. So we're going to limit our screen time, especially if we're wanting to decrease or reduce our emotional vulnerabilities and be better able to regulate our emotions. We're going to limit the screen time. Next, we're going to eat a balanced diet. So we're going to have all the food groups. We're going to make sure that we are actually eating those things as well. And we're trying to fuel our bodies in the best way possible and what we have access to. So we're making sure that we're eating our vegetables and our fruits, that we've got our proteins, the carbs, the grain, like we're engaging in a healthy eating balanced within that, the key thing that we are actually eating. Next, we're going to avoid substances, right? A lot of substances are depressants. So if I'm already depressed, I'm not going to use a depressant, right? So we're going to avoid substances. We're going to let our body heal. We're going to give it the best chance possible to be as regulated as possible without substances. Next, we're going to get balanced sleep. So I believe the optimal range for people is 6 to 9 hours. Within that, everybody is different. I've seen it also go up to 10 for people being optimal within this. So we're going to balance our sleep. We're not sleeping all day. We're not getting no sleep. We're finding a good balance. And then we're going to exercise. We're going to move our bodies for 20 minutes a day. And based on your capability levels, this can be walking, stretching, yoga. Doesn't have to be full on weightlifting, prepping to run a marathon or anything like that. It can be a very mild, easy thing. We're just needing to move our bodies for at least 20 minutes a day. And then next, we're going to problem solve. We're going to do what works. We're going to look at the situations, the scenarios, and go through all of that and what makes sense. And so that is our emotion regulation skill set. Next time, we're going to start with backing down from addiction. So these are the specific skills that Marcia brought in for when they call it when crisis is the addiction. And so we're going to do a deeper dive into the 7 specific skills that Marcia has set up for treating substance use, or the skill set for those. Were there any questions on any of the skill sets? So we had core mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. Oh, you might be one of the few that loves all the acronyms because they're hard to remember sometimes, but they do make them easy. Yes, there are worksheets. So I can show you. So Marsha within the skills, she has her books. So this is the one that we tend to use most often. So this is the DBT second edition. So this is truly like a manual for us. Like it breaks it down. What is the skill? How to teach the skill? It does have handouts and worksheets that go with it. They did just update this to this guy. So this is the newest version of the skill books. So yeah, DBT Skills Training Manual Revised Edition. It is mixed in the field right now. A lot of people don't like it. Some people love it. Most people are still using this guy. But so this is like the instructor manual for the therapist. And then it does have its handout companion that gives you the worksheets that you can give to the clients and the individual that you're working with. So there are worksheets that go with this. Where I work, we kind of break it down. We pull out certain handouts that go with it and within the lesson so that the clients have it when we're going over like the skills group. I am still, to be honest, working my way through this guy. She did add, so HALT is now in this guy. So hungry, angry, lonely, tired is in this guy. It's not in the blue one. A lot of it is similar. There's not too many changes. She does have it organized slightly different. But to be honest, I'm still working my way through that. So I'm still using the blue guy because that is what I'm used to. So those are the changes that I can tell you for sure that I've gotten to is HALT is in the new one. Because again, we need to have our acronyms.
I did add the post survey link in the chat. If you guys could take a moment to fill that out, I'd really appreciate it. Did we get through all the comments on the chat?
I think so.
Any major changes? Just great to have a review. Thanks for getting through all of that. Yes. Great
Yeah.
job.
And I would say you can be flexible, especially if you are at a situation where you have a separate group available and there is like a skills group and then your individual therapy. So if you know, like you started working with a client and you know that they really need distress tolerance skills and the group is in, let's say, interpersonal effectiveness, you can absolutely teach them the skill in your individual session versus just waiting for them to get it in their skills group.
Um, well, if there aren't any more questions, we'll go ahead and let everybody get back. Thank you for everyone. We do have 2 more weeks, the next 2 Fridays, that we will be having the sessions. I will be emailing out the links. I have the YouTube links that I email them to you, but they are also on the SUU Echo page. I will also mail out that link or email out that link to everyone. And just thank you everyone for attending. Thank you, Megan, as always, for a fantastic job. And really, really appreciate your time in teaching us. So thank you.
Of course. Thanks, everybody.
We'll see you all next week.